Hi, it's Dr. Janowski for Sonata. Today we're going to do a very simple, very basic injection for the nasolabial folds. As we age, they deepen, and we want to soften them out. You never want to eliminate the fold, but you want to soften them out. It looks good, patients like it. It's what I call a beginner area. It's a great area to start if you haven't had fillers before. I'm going to use Restylane Lift to fill those areas. And with my fillers, I'm typically diluting them one-to-one with saline. So we're going to mix saline into the product so that one syringe is actually two syringes once we're done mixing. What I like about the mixing is it hydrates the product before it goes in, so there's not a lot of swelling afterwards. And it really extends the amount of product that you have to use, so I think it works quite well. So we're just going to use a simple injection technique in the nasolabial fold, more important the upper part of the fold than the lower part of the fold. And hers are very mild, so we're going to use a half a syringe on each side. So I like to offer my patients a little vibration tool, which patients really like because it distracts the brain away from what we're doing and actually reduces pain. So we'll have the patient do that. And then you can come in a little bit closer, and then I'm just going to inject just a little bit right here. As you can see, I'm using also what I call distraction technique with my left hand. So if we tap the skin as we're injecting, and that's going to hurt less. It's going to be easier. We also, when we're injecting, we want to enter through the dermis quickly. So as I tap, I'm going to push the needle rather quickly through the dermis because that's where most of the pain comes from. And so we want to have as painless as possible in injection here. And so I very quickly push that needle in just a little bit at a time, then I'll massage. And so a little bit of this tapping is one of a number of methods that you can use to make things go easier for the patient. I'm already seeing a nice improvement there. I'll come a little bit lower here. And again, this is mixed one-to-one with saline. Restylane Lift, a nice product that you can put almost anywhere, really. Again, we're tapping as we're going in there. I like to make small boluses. Other people like to do linear treatment. I think this gives you more control. So we're almost done with this zone here. And we're going to tap. And so that's one half done. Good. Now we're going to switch around. Do the same thing on the other side here. I'm using the vibration tool here, and again I've got a 29 gauge needle, a little tapping, and very quickly with the needle through the dermis. You can see how quickly that goes through. We don't want a slow push, that hurts the patient more. We're not going terribly deep here, we don't want to get into the angular artery, so we're keeping it just about 2 millimeters, maybe 3 below the skin. Almost done here. We're going to do a little bit of tapping. Typically we see very little bruising in this area. Even though you can see some bleeding, there's usually very little, if any, bruising here. So we've got that in there. Good. So I'm just going to do a little massaging of the product like this, and then a little wipe down. That's it. Just took about a minute or two to do it.
Thank you.
Yeah. So that's just a basic, very straightforward filler injection using Restylane Lift in the nasolabial folds, using some pain reduction techniques, and using the one-to-one dilution. And you can see there's just a nice softening of that nasolabial fold. We can apply ice and makeup, and she's ready to go.